then just talk to you about, what to expect when you come for a dental checkup and what should happen at your dental checkup, because I'm a little bit worried that sometimes not all dentists are as thorough as I would like them to be for you, and that we're making sure you understand all the checks that are happening and why they're going on. So what happens at your dental checkup and clean appointment? What goes on during a dental cleaning and routine exam every 6 months? What can you expect at that routine cleaning appointment? First, I hope you will be greeted friendly and warmly in the patient lounge, and the dentist or the hygienist calls your name, they bring you through, they introduce yourself, and they take you to the back to the treatment room. We get you settled in, ask you how you are, get to know you, make some small talk, place a bib on, and we start you here at Evolve with an all-natural mouthwash to reduce the bacterial and viral load of your mouth before we go in there. We're going to go over any changes in your medical history, any new medications and things like that. Ask about your teeth, ask if everything's feeling okay or if there's anything bothering you, or if you're just here for a routine cleaning and exam. Next, if you're due for x-rays, we're going to let you know that. We generally take those every 1 to 2 years. We get x-rays on each side of your mouth, and they're specifically to check for decay, for cavities, tartar buildup, and have a look at the level and the health of the bone around your teeth. Now, if you've got a high cavity rate or we're monitoring the bone around your teeth, we might take x-rays at more regular intervals. Next, we examine the teeth, the jaw joint, the muscles, and the other surrounding structures for decay, pain, infections, functional issues, and we always perform a routine oral cancer screening to make sure there are no lumps or bumps or unusual looking patches in your mouth that could indicate a more serious problem. Before cleaning your teeth, we need to check your gums. So once a year, we do this. We use a little ruler called a perio probe, which takes measurements of your gums in millimeters. Now that probe slips in between the natural space between your gums and your tooth, and we measure that space to check the height of the bone and determine the health of the surrounding tissues. In healthy tissue, the measurement will be between 1 and 3 millimeters, and there will be no bleeding when the probe gently slides in and out between the gums. So 1s, 2s, and 3s are considered within normal limits. Number 4s are considered borderline, possibly an area of inflammation or tartar buildup, or the start of bone loss, and that we can tell from the x-rays as well. Number 5 and up will indicate bone loss, more advanced gum disease with irreversible damage in that spot. We can switch the gum disease off, but the damage to the bone and the gum health has already been done. We check these numbers once a year to confirm whether your gums are healthy or not, and whether they're improving if we've already done gum disease treatment. These numbers are recorded in your chart, and we use them as a comparison throughout the years. Then it's time for your cleaning. We start with a polish here at Evolve to break down and remove the soft buildup of plaque and bacteria from your teeth. The polish we use is a mix of bentonite clay and other products that help desensitize and remineralize your teeth and make the clean more comfortable. We follow this with an ultrasonic scaler to clean around each tooth, and that takes off the tartar, the stain, and any remaining plaque very well. The combination of the ultrasonic vibrations of that instrument and the flushing of the water that comes through it cleans your teeth very well. And we're going to have the suction in your mouth the whole time because there's a lot of water and nasty, messy debris in there, and we can help look after you, make you comfortable. Once we complete the scaling, we might do then a hand scale to remove any residual tartar buildup from the surface of your teeth. For some patients, we're going to floss in between all the teeth and contacts as well, before we get you to have a good rinse out. Then I like to apply a concentrated mineral, calcium and hydroxyapatite paste to your teeth. That helps remineralize and harden any porous or weak spots in your tooth enamel. Going to ask that you don't wash that out. Going to make you wait about 10 minutes or so, 10 or 15 minutes before you eat or drink, and we don't offer you any water to wash out with. This is how we prevent dental infections, gum disease and tooth decay, as well as diagnose things that present so that we can treat them early and help save your teeth, save you time and money.